39 months ago, I was driving my car. I suddenly realized I couldn't operate my clutch with my left foot. My left side was basically paralyzed. I could not move my arm or my hands or my left leg, but I was able to get the car through the intersection to the side of the road. To get me out of my car, paramedics had to lift me out. I didn't realize I had a stroke until about a day later. I was in rehab here at USC, where they bring in therapists who are experienced in the field, and they teach them new techniques and new technology, new means of diagnosing and treating patients.
Physical therapy is a profession which treats individuals with a variety of different diseases and impairments. The unifying concept is that we treat people who have difficulty moving because of some disease or pain or developmental disorder. In the Division of Biokinesiology at USC, we have really four broad areas of research.
My area of research is focused primarily on neurorehabilitation. So we basically come up with physical interventions that help people recover after stroke. What we're learning now is that you can grow new neurons well into old age, and that principle is now being harnessed and being used for rehabilitation.
Second area is musculoskeletal biomechanics, which is the study of the muscles and the bones of the body and how we can improve the function of patients with orthopedic injuries. The third area is cardiopulmonary or cardiovascular and exercise. We try to improve the way we do exercises for patients. And the fourth area is motor development.
My line of research is really to understand the development of infants and children. I'm particularly interested in how they learn and how they use their bodies in that learning process. I think being the #1 ranked program in the nation is a responsibility and a challenge for us at USC. It is remarkable that the division has not only attracted but supported and developed leadership in the profession of physical therapy. And that's very exciting to be around. Our students see that, they benefit from that, and we as faculty expect that they're going to be the future leaders of our profession.
This is one of the most rigorous programs. I've learned what hard work really is and what I'm capable of. It's pushed me to do things that I never thought I could do before.
When I was looking at the physical therapy program as a student, I looked at it as an investment. I wanted a program where I can invest in myself as a future clinician, as a future practitioner. Simply put, I fell in love.
I get emotional when I see students learning, when I see light bulbs go on. That sort of touches me.
When I tell people that I am a graduate student at USC Physical Therapy, especially other professionals, the best thing is kind of their look on their face because they know what it means. They know that I'm getting the best possible education.
And I think that's what sets us apart, is that we train our students not for physical therapy as it is today, but how we want it to be in 20 years and 30 years. And they get the skill set to be able to progress themselves as the profession changes.
I think our division's relationship with the community is very strong. We have a clinical faculty practice on the health science campus, and we see quite a bit of individuals within the surrounding community, and we treat them as patients.
I think that every day that I get to work with patients is a day I feel pretty great.
I guess the thing that really turns me on about being a physical therapist is trying to unravel the mystery that every patient brings to me. And it's like being Sherlock Holmes with every single patient.
We give them a little bit of hope and push them and sometimes pull them into doing something. It's remarkable to see how the spirit can soar.
I do think there's a transformational component to being a physical therapist.
I think there's a reason why as a profession we have high job satisfaction and we love what we do because of the effect that we can have on our patients, and then conversely the effect that they can have on us.
What makes the Division of Biokinesiology and Physical Therapy unique is not just that we have great research and accomplished teaching faculty and also our clinical practice, but actually that we have all of those and that we excel in all areas.
So when you look at the people within this division, they're all very passionate and very driven to provide the best knowledge to the students, the best knowledge to the patients, and ultimately the best care.
I will always be connected to this division. I'll always be connected to this group of people. You very much become like family.
It's difficult to imagine that the Division of Biokinesiology and Physical Therapy could have accomplished what it has accomplished in the last 40 and 50 years without the contributions of our alumni.
The recipe for success at USC, I believe wholeheartedly, is the concept of the Trojan family. And it really has many true aspects of being a family in terms of supporting each other and really striving for excellence as any family would.
The beauty of our division, the beauty of our leadership, the beauty of our faculty is we're not content. We are a division that cares about our patients. We are a division that cares about our students. We are a division that cares about our community as a whole.